Ladies and gentlemen, good morning and good afternoon. I'm quite sure that there are a lot of people attending this very webinar, and they are from different time zones. It's truly an international company in here. At the beginning, we'd like to thank you for your very precious time. And I want to assure you that any kind of feedback from your side is the most precious for us. There are several reasons for organizing this webinar. The most important is fitting into the global trend of increasing independence of individuals when it comes to taking care of their own health. Secondly, the stress in healthcare has been moving from treatment to prevention, and we think our solutions integration can improve people's health-wise self-awareness. Finally, we're convinced healthcare does not need to be done when something bad happens. We can turn it into an enjoyable habit that perfectly fits our lifestyles. Okay, so we are now going to show you 4 pre-recorded sessions that present our products and their use cases. If you have any inquiries in the meantime, please ask them in the chat window. We here are all to respond to them. In the end, we're going to have a live Q&A session. Okay. Again, any feedback on your side is the most precious for us. We are looking forward to receiving inquiries from you. All right, over to you, Marcin.
Hello everyone, a warm welcome from Krakow. The topic of this part of the webinar is Comarch Diagnostic Point, which is one of the most modern solutions in the field of remote medical care and enables the provision of medical services, for example, diagnostics at any place and time. My name is Marcin Potacek, and I'm a business solution consultant in Comarch Healthcare. And in my daily work, I specialize in solutions in the field of healthcare and medical services provided remotely. As you already know, in this part, I will present you a diagnostic point. However, before discussing the diagnostic points, I would like to briefly introduce you to the world of remote medical care. So what remote medical care is? In short, it is a constant health monitoring and modern diagnostics without the need to visit a doctor. It is a telemedicine service which allows constant monitoring of the patient's conditions and performance of preventive and controlled checkups outside medical facilities. Why is it so important today? At first, nowadays, healthcare providers are facing a number of challenges, such as aging population, a higher number of chronically ill patients, growing costs, and demand for a better care. This is why services like remote patient monitoring are becoming a necessity around the world. The remote patient monitoring utilizes technologies which allow data collection from patients in any location and then transmit it to a specialist for an assessment. These are services of proven medical value, facilitating communication between patients and physicians. Remote medical care facilitates access to healthcare, thereby increasing the convenience of patients and their families, and is also a relief for medical staff and overcrowded medical facilities. Increased patients' awareness, commitment, and self-control contribute to improving treatment outcomes and reducing the number of readmissions. The benefits of remote healthcare come in mind automatically, and I think each of you could add can add a few other benefits of remote monitoring. When talking about remote medical care, it is impossible not to mention the coronavirus pandemic. Before the SARS-CoV-2 coronavirus pandemic, telemedicine and e-health were considered attractive technological innovations implemented mainly by commercial healthcare providers. As a result of a pandemic, virtually all patients and healthcare providers have been forced to use such solution, and mainly for medical consultations. With the health crisis forcing their hands, many skeptics have discovered that technology can really improve medical care, and after some learning, using it turns out not to be so difficult. Due to the high risk of virus transmission in medical facilities, the majority encourage patients to contact them via phone or online. Some countries like Poland and the USA published new regulations and recommendations concerning the provision of remote medical advice. Some of the barriers that hindered the widespread adoption of telemedicine were removed, while the reimbursement program was extended and subsidy schemes were launched. The teleconsultations and the video consultations, which had been a niche, suddenly came to the first in communication between patients and medical professionals. So COVID-19 prompted a revolution in healthcare, forcing us to use tools which have been available for many years, but which seemed unnecessary until now. To provide remote healthcare services, three main elements are needed. First, monitoring center, which monitor patients' health status outside of a hospital environment. Second, the telemedicine platform, which is responsible for collection and management of the data. And third, the medical devices connected with the platform. For example, diagnostic point in today's case. Due to the fact that we have a limited time today, we will focus only on the detailed description of the last element, the telemedical device Comarch diagnostic point. So, what the Comarch diagnostic point is? The Comarch diagnostic point is a solution that allows patients to perform independent preventive and diagnostic examination at external, generally accessible measuring stations. The diagnostic point is to provide and facilitate extensive preventive health care. It is a quick and safe alternative to traditional medical consultations. The primary role, the primary aim of Comarch diagnostic point is to provide patients with access to medical equipment and enable them to measure their primary vital parameters and get advice about their results by consulting a specialist via dedicated cloud-based telemedicine platform. With diagnostic points, medical care may be provided in workplaces, schools, airports, shopping malls, public institutions, or even on board a ship or a plane. So diagnostic point consists software installed on a dedicated tablet and medical devices enabling simple and quick measurement of each patient's basic vital parameters. And thanks to the possibility of cooperation with a wide range of devices like ECG recorder, pulse oximeter, blood pressure monitor, scale, thermometer, and many, many, many more, the Comarch diagnostic point is a very universal tool. Like I said, a Comarch diagnostic point consists of devices and software enabling simple and quick measurements of each patient's basic vital parameters. The system guides the patient step by step during examination process, and the user can make self-examination without any help. After the examination and after the data analysis, patient receives results in an encrypted email. There is also possibility to make a video consultation with a doctor. So in short, measuring devices collect medical data like, for example, saturation, temperature, blood pressure, ECG signal from the patient and send it to the diagnostic point tablet using a Bluetooth connection. After that, the patient's data is sent to the Comarch eCare platform for a physician to evaluate the results and recommend any follow-up measures. The patient receives a report with recommendation and comments. If the results deviate from standard values, the patient is prompted to contact a relevant medical specialist. In such cases, the system offers the opportunity to schedule an appointment or a video consultation. You can see such an example report that I received for the diagnostic point on the left side of the slide. Yes, that's how it looks like. So the diagnostic point is offered in several configurations, and there is no difference between the diagnostic points configuration except for their dedicated purpose. For example, a stationary diagnostic point may be good solution for corporation because direct and immediate access to a diagnostic point may be considered as an attractive addition to an employer's typical benefit package. Can be good for transport hubs like airports, bus stations, railway stations, and ports, for example, to improve passenger safety. For shopping malls, because it can be opportunity for malls of all sizes to adapt a customer-centric approach and keep up with the latest trend of promoting fitness and healthy lifestyles. For public institutions, for hotels and sanatoriums, and for gyms and fitness clubs. For example, to monitor progress towards health and fitness goals through regular measurement of vital parameters. The mobile versions are perfect for patients with impaired mobility, such as those in nursing homes, or who are in locations with limited infrastructure, for example, cruise ships, planes, trains, etc., or for remote geographic areas where many elderly live without proper medical services available. Yes, since we already know what a diagnostic point is, I would like to finally show you how the examination process at a diagnostic point looks like step by step. So, patient starts the examination by entering the phone number to which the confirmation code will be sent. On the next screen, patient needs to provide the confirmation code, and then he needs to consent to the processing of personal data. And now the patient is ready to start medical examination. First step is to complete the medical questionnaire. At first, patient has to answer 3 questions about smoking cigarettes, drinking alcohol, and about level of his physical activity. And answers for these questions will affect the examination process in the next steps. And the next steps are the tobacco and alcohol addiction tests. These surveys only appear when a patient selects that he smokes and that he drinks alcohol. And here it's worth to note that the diagnostic point can be also enriched with other tests, questionnaires, and surveys, depending on the client's needs. And after the questionnaires, patient goes to the examination part. He can choose what examination he wants to perform on the screen. And after choosing the examination, for example, blood pressure measurement, patients sees detailed description of the measurement, and thanks to that, performing the examination is very simple for the patient. After measurement, results appear on the screen, and when patient wants to end the examination, he can click the end examination button in the right bottom corner of or he can consult a physician via video call by clicking the green button in the upper right corner. When patient clicks the green button, he connects directly to the specialist and can consult his examination results, and also can repeat the measurement during the video call with a physician. After ending examination, patient has to choose one of 2 reports, basic or medical. If he chooses medical, he will receive an ECG report analyzed by a qualified physician, graphic presentation of his results, and personalized advice. To send the data for analysis, patient has to provide his personal data like name, surname, email, address, and his ID number, which will be the password necessary to open the results sent by email. And now the examination the examination process has been completed, and after a while, patient receives the results with personalized description in an encrypted email. And that's how this this report looks like. Yes, and this is it. Yes, I see that I ran out of time a little bit. So thank you for your attention, and please feel free to ask questions. Thank you.
My name is Marco Ricci, and today I will give you a brief introduction of Comarch Loyalty Solutions and how a loyalty program can help improve quality of life. Let's take a look at the agenda of today's of my short speech. First of all, I would like to highlight the impact of health-related issues on organizations in terms of threats and opportunities. Then I will introduce you to Comarch Loyalty Solutions, what they are, and how they can help. And finally, I'll make an example of a loyalty program used to engage and motivate people in order to live a healthier lifestyle. So let's first focus on what the cost of sickness and disease for organizations and which opportunities arise from helping people live in a healthier way. Any organization faces a huge threat in the form of employees having to leave or not perform at 100% level due to sickness and various kinds of diseases. And particularly chronic conditions can dramatically affect people on the workplace. So motivating people to monitor their health status and preventing insurgence of disease and complications is key. Also, showing that organizations care, the organization cares about its employees' well-being is also a good strategy to attract and keep top talent, as demonstrated by these data. We all know the importance of attracting and retaining customers and clients, but we should also be worried about the people who contribute to our organization's goals. Certain businesses are strictly connected to health considerations, obviously, and in this slide, I mentioned insurance or nursing homes, for example. In these industries, promoting a better quality of life directly translates to decreasing risk, and this translates in turn to lower healthcare related costs generating from insurance policies or caring services. But finally, I would also like to point out that providing people with the possibility to have a fast and reliable checkup, for example, with the Comarch's diagnostic point, is in itself a service which can be offered in any retail environment. And this can actually help attract more visitors, increasing footfall, and also generating additional business opportunities. For example, use the diagnostic point and receive a voucher for a natural supplement that you can get at the nearby herbalist shop. So, loyalty programs are a powerful, let's say, powerful tool, powerful way to engage and motivate people to pursue specific behaviors. And at Comarch, we are globally recognized as a leading loyalty solution provider. Let me introduce you, how our loyalty solutions work and what is our experience in this specific industry. So in Comarch, we have 18 years of experience when it comes to implementation of loyalty programs. And currently, over 600 people are dedicated to this sector in Comarch. To give you an idea of what this means, consider that almost 300 million people participate in loyalty programs run through Comarch Loyalty Solutions. And almost 57,000 business users log into our systems to manage those projects. So when a company wants to introduce a loyalty program, Comarch Loyalty Solutions can take care of every aspect, starting with member registration, which is when a customer or employee decides to join the program and become a member of the loyalty program, right? So, loyalty programs are based on incentives. So basically, any loyalty program is based on incentives that are available to members for their behavior, which in our case will be health-related behavior. And so Comarch solutions allow for a high degree of flexibility in doing this with a powerful rule builder. And then obviously loyalty programs need to be engaging, and an important way to achieve this is to communicate directly with the member by using multiple channels. For example, a person might prefer being contacted via a mobile application. Another person might prefer email, and so on. Communication is another very important pillar of our loyalty solutions. Rewards, obviously, and they can be anything. They can be anything from vouchers or coupons to free services or gifts. And very often, building a successful loyalty program requires building an appealing set of rewards and also benefits that might include partner services or products. For example, a gift certificate for a 1-month gym subscription. So this is an example of using rewards provided by a partner. But today, more and more, we see that in addition to classic logics, like points and rewards, in order to keep members engaged, additional logics need to be introduced, and specifically game-based logics. So this is why we have a specific module for gamification, which basically allows you to reward a member engagement and little behaviors in an inexpensive but appealing way. So going further, so Comarch Loyalty Solutions obviously come together with member front ends, meaning web or mobile portals where members can access the program, okay, and manage their participation in the program. And we also offer built-in segmentation and level attribution logics, which are a very important way to customize the experience of members. For example, we can have different communication styles or different rewards based on the customer profile. And also they are a powerful tool to make the loyalty program more engaging, especially levels, and with the possibility to create different levels, VIP levels, exclusivity, and so on. And finally, Comarch Loyalty Solutions come with reporting tools that allow to make sense of all the information that is generated by the loyalty program and track key performance indicators over time. So let's say that this is basically the basic set of tools within our loyalty solutions, but we can also help companies and organizations to design and to implement and to actually run loyalty programs. So we do not only provide the technology, but also our professional services and expertise. Okay, but the most basic, let's say, goal of a loyalty program is motivating people to behave in a certain way. Comarch Loyalty works as a smart application, basically, that is able to capture behaviors, process that behavior based on the rules which are set up in the system, and attribute some kind of result or incentive. Use the diagnostic point and get some credits, some points, plus a communication with a voucher, for example, or reply to a quiz about health-related good habits, for example, and get some gamification badge, and so on. So all of this happens in real time over the internet. I would like to make an example, and I will use an example from a workplace loyalty program. Okay, I know that my colleagues will talk about multiple additional use cases later. This is Alfred, and let's imagine that Alfred is an employee at your company. So he basically joins the company loyalty program, which we call Healthy Employee, okay, and receives this message that you are reading here. So the program is based on earning hertz, which is another way of calling points, okay, based on healthy behavior. For example, Alfred can get 3 hertz if he performs a checkup at the diagnostic point. So here we have an incentive, right? And then what happens is that Alfred will have the possibility to redeem or use or convert those hertz after reaching 9 hertz. Okay, he will have the possibility to redeem them to get 1 month of free, let's say, free gym subscription at a local partner of the company. So here we have, the element of the partners of the program. And then in the end, we also mentioned a mobile application. And this is somewhere Alfred can actually use not only to track his participation into the loyalty program, but also to do something more, to have fun with his colleagues. So there will be some tasks, some challenges that Alfred will be able to do with this mobile application. And when I talk about gamification, so basically the role of gamification in loyalty projects today is very important. Gamification means using game logics in non-game scenarios. So, for example, business or healthcare. And we developed a dedicated module for this. And this module allows to reward small behaviors like responding to a survey or reading a blog post or watching a video about health-related issue, for example. And so when talking about gamifications, we use proven psychological triggers like competition, achievement, teamwork, and so on. And this obviously translates to, for example, badges, counters, leaderboards, competition with other users, and so on. And so this is really something that's very useful for keeping people engaged in the loyalty program. So we see badges, labor counters, quizzes. So all these are tools that we can actually use and incorporate into our front ends. So I hope I gave you a good idea of what Comarch Loyalty can do, and especially together with our healthcare solutions to improve quality of life. So thank you for your time, and please stay with us for the next part.
So good morning, everybody. My name is Nicky Joost, and I work at Comarch Healthcare as a business development manager for the Netherlands. And today I'm talking to you also from the Netherlands about how we in the Netherlands think about having access to personal healthcare in a personal healthcare environment. And I'll start my presentation with an introduction about digital healthcare in the Netherlands, as I know that the audience today is quite international and you might not be aware of how we arrange healthcare in the Netherlands. After that, I'll focus a bit more on access to healthcare data up to now in particular, and how we'll do that in the future. And the last part of the presentation is about how the MedMij framework and having access to digital healthcare in the future has implications for the Comarch Health Note application that we'll be launching very soon here. So let's start with the Netherlands. In the Netherlands, out of a lot of research and reports from, amongst others, McKinsey, we see that we are front runners in e-health. And there are lots of initiatives in the Netherlands that have been started in the last years. And that's true. We see that there are a lot of initiatives, and also that despite the lack of coordination, there is a lot of cross-fertilization between different stakeholders in healthcare. So you think about cooperations between the government, between hospitals, academic medical centers, and industry partners. And you see that also in terms of subsidies and other incentive schemes to adopt e-health in the Netherlands, that we really try to focus on digitizing the entire healthcare industry here. And if you then focus on what we are really doing, you see that the main priority is basically putting the patient central and improving the dialogue with the healthcare providers. You see that in terms of data exchange, but also having better access to information and letting the patient contribute towards their own health by having them generating their own data. And if you take those priorities and you transfer them into the biggest trends that we currently see here in the Netherlands, it's really about exchanging data, monitoring yourself and your vital parameters at home or somewhere else, and putting them in your own personal patient health record that you can then share with whomever you want. And that really brings me to how do we actually have access to healthcare data now as citizens of residents of the Netherlands? What you can see here is that there are basically two domains. On the top, you see the navy part, that's the healthcare provider domain. You see different silos like general practitioner, different hospitals, and the pharmacy, for example. And the dotted lines in between, that implies that there might be some data exchange in between them, but not necessarily. If you then go to the bottom line, you see, to the bottom part of the presentation, you see that there is also a patient domain with different portals. For example, you have a portal for a general practitioner, and when you look at the greenish arrow, that basically shows that a patient can send data towards their general practitioner. But it also works the other way around with the blue arrow, that the general practitioner can send some data towards the portal of the patient. There is, however, one big issue here. For each healthcare provider, you need to choose a different portal. So in the end, you end up with having multiple applications on your smartphone or iPad, which works, but it's in the end quite a hassle. That's what the government thought as well. And that's why a couple of years ago, they thought, okay, we can do that actually differently here. And that's when MedMij was born. And MedMij is an organization that basically should solve the issue of having the need of having multiple applications to have access to your healthcare data. So the goal of MedMij is to aggregate all healthcare data into one application that you can choose yourself. And that application, we call it the personal healthcare environment, or a PGO in Dutch. And the reason why the government came up with this is that they really want to put the patient central. They need to have the grip on their own health. So having one application where you can manage your entire health record allows you to collect, manage, and share your health data with whoever you want. And basically, the two tasks of the MedMij organization are, on the one hand, to facilitate digital data exchange between us here in the Netherlands and the healthcare providers, but also to ensure that this is done in a safe and secure way. Because we all know that healthcare data is at high privacy risk, and people can be a bit hesitant about sharing their data. So having an application that complies with all relevant data safety standards as well as privacy regulation is critical to have a high adoption rate here in the Netherlands. So if you now look at how healthcare access to data should look in the future here, you see quite a difference with the graph that I showed you a few slides back, because you still see in the healthcare provider domain that there are still different organizations. Of course, we still have general practitioners, different hospitals, and so on. However, the user can choose his own personal healthcare environment and uses that one to view and collect all of his own data. So you might be wondering, what is actually the difference then between a portal and a personal healthcare environment? And I borrowed this insightful table from a MedMay presentation that I looked up a few weeks ago. And the most critical difference is that in a portal, you have access to one healthcare provider. In a PGO, you have access to several healthcare providers. In a portal, the information is still at the care provider domain, whereas with a PGO, you can collect your own data in the application. And portals are very limited in choice because you need to choose that one that your hospital or your general practitioner offers you. And most of the time, that's actually the one of the hospital. Whereas with a PGO, you choose the one that you like the best with the features that you need, and then you can access data from whatever hospital or GP that you are with. So in a portal, it's also very difficult, if not impossible, to share information with other people, because there is a one-way connection with the respective hospital that you shouldn't use the portal of. Whereas in a PGO, you are the one in charge to share information with whoever you want. So, of course, having a complete mind shift and a new organization that guides this process has some implications for the people here in the Netherlands. And the main aim of this whole MedMay and PGO is to facilitate a better dialogue with your care provider. And it has several benefits for us. And the single most important one is the convenience. Everything is in one place, it's safe and secure there. And it puts the patient central, in the sense that you are the one that's in charge. You choose which data to collect. You choose the data with who you want to share it. And you also choose the means to do that by having the option to choose the PGO that you like the best. If you then look at the implications for healthcare providers, so the ones in the other domain, the aim is in the end the same, having a better conversation in the consulting room. So a better and improved conversation between the patient and the physician. But it's critical to understand that a PGO is not something similar to a medical file, because a medical file is the responsibility of the physician. And they're also a bit hesitant normally, because they really want to focus, like, this is my file, I'm responsible for this file. And by having a PGO and having access to a medical file, but not the ability to adjust something in the medical files, you also allow that the professional secrecy of the healthcare providers is still safe. And you can neither see personal notes that are right there. And related to that and to the professional secrecy is that it is vital for healthcare providers that if they exchange data, that it's of course compliant with law and regulations. And if you do that through a MedMay application, you're sure that that is the case. So with MedMay and the personal healthcare environment, you basically connect the healthcare provider domain towards the patient domain. And the connector here is an application. And the applications are built by IT suppliers. So of course, there are also some implications for MedMay for ICT suppliers like Comarch. And the main aim of the MedMay framework is optimal interoperability, because there are different systems in the patient domain than in the healthcare provider domain, and they should be able to communicate with each other. And that's why MedMay has created a system of agreements. So basically, the rules and the code that you should follow to allow optimal communication between those systems. But they not only made the rules, they also actively support us as ICT suppliers to make it as easy as possible to develop applications for this. And the main benefit for us is there is, of course, a completely new market, but also that the government has really focused on adopting personal healthcare environments by founding multiple funding schemes as an incentive for us to develop applications like this, but also as an opportunity to monetize them in the future if patients really use our application. And it's also a quality standard, especially as Comarch is new to the Dutch market. People might be hesitant with connecting with us, but once we are compliant with MedMij, it shows that we are fully up to the Dutch standards on privacy level as well as on data safety, which is vital, especially in healthcare. And it allows, of course, for new forms of cooperation to collaborate with healthcare institutions as well as with patients. So if you then look at the product at a Comarch product that is influenced by MedMij and personal healthcare environment, it's Comarch Health Note. And Comarch Health Note is a healthcare diary for mobile or that you can use on laptops that allows you to collect data and complete your own medical record. And you can do that by, for example, adding your own healthcare data. You can then exchange it with your healthcare professionals. And the reason that Comarch developed this application is because we realized that it's going to be even more important in the near future to have access to your own data and to have personalized knowledge, for example, through blog posts. That should be done in a very safe way. And it's in the end all about what the Dutch government also sees is the dialogue between the patient and their healthcare provider should be improved. And that is possible when patients collect their own data, get more in charge, and have access and the ability to share it with the healthcare professional. So as I mentioned, it comes with in 3 different applications: 2 on the patient side, a healthcare mobile application, a web application, and an overview for the physicians on their laptop. And patients can then input, view, and transmit data towards the healthcare professional, which allows for medical support and an improved medical consultation. So that is Comarch Health Note as it is now. And in the near future, we will be launching it here in the Netherlands, and we'll likely start a MedMij application to ensure that Comarch Health Note will be one of the personal healthcare environments that's going to be adopted in the near future. So as a wrap up, what is most important to take away from this international webinar and then the Dutch view is that here in the Netherlands, we've always had a very strong focus on digital healthcare. And most in particular, we focus on the dialogue between the patients and the healthcare providers. And we do that by having a better data exchange and by letting patients generate their own data, be in charge with that, share it with their healthcare professional. And MedMij and the personal healthcare environment is a catalyst for that. So I want to thank you for your attention. And if there are any questions, I'll be there in the Q&A at the end of this presentation. So shoot me any questions if you have one. Thank you so much for your attention.
Okay, let's move on to the 4th section of today's webinar. It's going to be dedicated to the presentation of a few scenarios of how the solutions that my predecessors explained to you about can work together to improve the user's quality of life. The scenarios I mentioned will be focused on the entities that the solutions are destined for. I'll start with the main part, consisting of the scenarios for workplaces, insurance companies, as well as hotels, health resorts, airports, and shopping malls. Additionally, I'll explain further the synergetic use of the aforementioned solutions in the clinics and hospital emergency department settings. Let's begin with the workplaces then. Despite the new status quo being remote working that the current pandemic imposed on us, work remains the most important part of our lives for most of us. We all work, so staying healthy, focused, and getting on well with our colleagues are key elements of staying productive and being satisfied with our work lives. In most countries, employers are obliged to provide free, periodic medical examinations for their employees. Usually, those examinations are performed in external facilities, which necessitates that the workers take at least half a day off to use public transportation get to a crowded clinic providing the checkups. Needless to say, it increases the odds of contracting the virus. Thanks to Comarch diagnostic point, preventive and periodic examinations can be performed at the employer's premises. Those can involve but not be limited to cooperations with their offices in high-rises, production facilities, and so on. In this case, the employees that are subject to the examination are supposed to be free from serious diseases, since those require special treatments. The recommended version of the diagnostic point should be mobile, as it can be easily set at the reception desk or a designated room or space to protect the patient's medical records and prevent theft. Regarding the flow of the examination, the employees would do the life parameters measurement with the diagnostic point preventively at their company's premises as a benefit. After the checkup with the diagnostic point, the employees will receive reports by email, or if they are Health Note app users, also directly to the app. For each use of diagnostic point, employees with Loyalty app receive points or a voucher for services provided by employer or its affiliates. The next kind of entities are included in today's scenarios are insurance companies. Solutions like diagnostic point can contribute to significant savings for insurance companies because early detection of health anomalies pushes down the number of expensive treatments and hospitalizations. In the case of insurance companies, the goal would be the preventive and periodic examinations for local residents who have Health Note app installed on their devices. In order to broaden the range of potential users, we would recommend both versions of the diagnostic point, stationary and mobile. The reason being that is some users would be able to visit insurance companies' designated space to have their checkup. In this case, the stationary version would be fit for purpose. Some people, like elderly or handicapped, would need to be visited by paramedics with the diagnostic point in a suitcase. Let's assume that the user intends to perform a checkup including temperature, blood pressure, pulse oximetry, weight or weight with body composition analysis, ECG, heart and lungs condition, hearing, video consultation. Video consultation is optional and it requires affiliation of the insurance company with the medical facility and healthcare professionals. By the way, the medical devices that you can now see on the screen are just examples of what can be integrated with Comarch diagnostic point. To perform the examination, the user should first enter the diagnostic point and scan their health insurance card. If their card does not allow scanning to obtain its data, manual input will be necessary. Also, when it's the very first time for the user to perform tests in the diagnostic point, he will be asked to enter phone number, email address, name, surname, and ID. In order to enable setting payments, the insurer should set payment rules depending on the type of insurance in eCare or in the loyalty system. For example, Type A, free visit, Type B, 70% reimbursement, etc. It all depends on the specific healthcare insurance regulations in the country of use. Also, there is a functionality in the diagnostic point allowing the insurer to import a database of patients with already marked types of insurance. As you can guess, it saves a lot of work. Then, after performing the checkup tests, the user makes payment through his loyalty app. In the case he had some points collected in the app, he can use them to make the payment. For each use of the diagnostic points, users with loyalty app receive points or vouchers for services provided by the customer. For example, fifth visit to diagnostic points can be free of charge. The data obtained through the tests will then be sent to eCare for the analysis performed by artificial intelligence algorithms. Then the doctor will examine ECG as well as the stethoscope and otoscope results to decide the overall diagnosis. After that, the user will be sent an email and/or a health note of identification containing automatically generated report, test results interpretation, and recommendations. There is a number of benefits that can be enjoyed by both the insurer and the patients. Insurer benefits include performing preventive measures in cooperation with the doctor, incentive through vouchers and points, revenue from each performed tests, and, in the long run, less costly treatments and hospitalizations. On the patient side, we see improved quality of life, improved availability of healthcare, increased, what is important, health awareness and knowledge. All right, let's move to the next kind of entities. We have hotels, health resorts, airports, and shopping malls. As we observe the ongoing global trend of health awareness, installation of our diagnostic points within such entities can contribute to their improved PR and consequently sales. In the case of hotels, health resorts, airports, and shopping malls, the goal would be preventive and periodic examinations for guests, visitors, travelers, shoppers, etc. Here, we will recommend a stationary version of the diagnostic point that will be installed in halls, lobbies, corridors, etc. Let's assume that the user intends to perform a simple checkup that includes temperature, blood pressure, pulse oximetry, weight or weight with body composition analysis. In this case, the diagnostic point would be free to use. The only data the user is supposed to put in are phone number, email address, and that's it. Then the user enters the diagnostic point and performs the tests. For each use, a user with a loyalty app matched by email or phone number receives points or a voucher for services provided by the customer or its affiliates. Similarly to other cases, after completing the examination, the user will receive an automatically generated report with checkup results by email or to the Health Note app. There are also other cases of entities that we think may benefit from the usage of Comarch diagnostic point. Those are clinics and hospital emergency departments. Let's begin with the clinics. Traditionally, clinics are visited by patients who intend to have health examinations or see doctor for some specific reason. Clinics routinely perform basic life parameters tests and then proceed to more specific examinations. In the times of increased seasonal infections like flu or pandemics like we have now, there will be crowds of patients coming to clinics and thus increasing the risk of infection. In times like this, increased efficiency of medical services, as well as keeping the patients away from each other, are crucial. The goal of diagnostic point use at the clinics would be preliminary tests before the visit, periodic measurement of patients' life parameters. We believe it may be helpful for clinic patients being chronic patients with a wide range of diseases in various stages, seasonal patients, healthy patients undergoing checkups, patients queuing for medical appointments, and inbound patients for periodic checkup. We recommend stationary diagnostic point to be set in the clinic's premises in the designated space or room. The role of the diagnostic point in this case would be streamlining the patient's visit to the clinic. First, the patient comes to the clinic for an appointment, then he performs tests before being admitted to the doctor while waiting in line. Before starting a visit, the patient will have received tests, a report that can show to the doctor, shortening the time of the visit and improving efficiency. Finally, allow me to introduce the hospital emergency department's case. In this case, the goal is the triaging of the following: patients coming to the hospital emergency departments on their own, urgent patients, patients with varying degrees of emergency, patients with severely exacerbated diseases. For this case, we recommend the stationary diagnostic point to be set in the hospital's premises in the designated room or space. Here is how we see the whole process. The patient comes to the emergency department and gets registered. Then the patients perform diagnostic point tests to determine the urgency of patient's condition. Based on the measurement results, the patient is assigned an urgency grade. With this process in place, the risk of overlooking the patient that needs immediate attention will decrease. Thank you very much for listening. Ladies and gentlemen, thank you very, very much for the participation and for your patience and for many, many questions. By the way, is there any chance for you to have any more questions in today's session? Do you have any more inquiries? Yes, I can see. Thank you, and I can see some praise words, which we really, really appreciate. Well, regarding the material questions that you may have later on, you are always welcome to ask them, because we are going to send you some follow-up information. We're going to send you a newsletter, and of course, you're always welcome to ask us any questions that you like and any proposals that you may have. We are always eager to respond to them. Do we have any questions? Is there anything the other speakers would like to mention? Martin, Marco, Nikki?
I think that I'm good for now. I want to thank everybody for their attention, and if there are any questions popping up later, you can just contact me over LinkedIn or by email. So let's stay in touch.
Thank you, everybody. Also from my side, and greetings from Italy to everybody.
Yes, thank you very much also from my side. And of course, if there's any questions due to the diagnostic point, we are still here for a while, and we're waiting for more questions. So yes, that's it. Thank you.
Thank you very much. Thank you very much. So let's call it a day. We are waiting for your question and inquiries. So you're always welcome with them. Well, that will be all for today. As I promised, we're sending you a newsletter and a summary of today's webinar. If you missed something while watching this webinar, you will be able to access a link. We'll probably upload it to YouTube, so be able to see the whole webinar all over again. Thank you very much, and hope to see you again. Bye-bye.
Bye-bye.